None of the producers have any financial interest in the products or procedures shown. Pinhole pupil, by definition, is a pupil contracted to the size of a pinhole. The nautilus is a marine mollusk and has developed an inborn pinhole eye. Significant irregular corneal astigmatism leads to ocular aberrations. High astigmatism can occur in radial keratotomy, penetrating keratoplasty, corneal injuries, intracorneal ring segments, or keratoconus. To solve the problem, one can use pinhole IOL or a Trindade extra focus IOL, dark, limbal relaxing incision, penetrating keratoplasty, or laser procedure. Pinhole visual acuity is an indicator of the visual potential of an eye and also of the best corrected vision that a patient can perceive. In pinhole pupilloplasty, the pinhole blocks light emanating from the peripheral cornea and allows the passage of central and paracentral rays that enhances the visual acuity as well as the image quality. Stiles-Crawford effect of the first kind is a phenomenon when light entering the eye near the edge of the pupil produces lower photoreceptor response compared to light of equal intensity entering near the center of the pupil. Vignetting in optics is a reduction of image brightness towards the periphery compared to the center to draw attention to the center of the frame. The same principle helps in pinhole pupilloplasty. The principle of small aperture optics has been placed at the level of cornea and at the level of the lens to correct presbyopia by enhancing the depth of focus. A similar principle, when played at the level of iris and pupil, works efficiently by filtering the defocused rays emanating from the irregular peripheral cornea and increasing the visual potential. The disadvantage of making pupil too small, less than 1.5 mm, is that diffraction of light occurs and the light waves bend around the corners of the aperture. In pinhole pupilloplasty, angle kappa or chord length mu is decreased, reducing all of the odd harmonics of the Zernich. Understanding these principles, we decided to create a pinhole eye through pupilloplasty. A patient had a patch graft done for a small incision cataract surgery SICS, landing with high astigmatism of 20 diopters on the pentacam. A trocar AC maintainer was fixed, 2 side port incisions made, and a single pass 4-throw pupilloplasty planned. The synechiae were broken between the iris and the peripheral cornea. A straight needle 9-0 or 10-0 Prolene suture passed through the cornea and the iris. On the other side, through a paracentesis, a 26G or 30G needle was passed through the iris. The two needles were connected with the railroad technique and the suture loop brought out as a single pass. 4 throws were then passed through the loop to create the single pass 4-throw pupilloplasty. The AC can be maintained with either an ophthalmic viscosurgical device OVD or with fluid infusion with the help of anterior chamber maintainer or a trocar ACM. Usage of an endo-illuminator can help in visualization, though it is not mandatory. Pupilloplasty can be performed with any technique: circlage, Seepsers, mechanal, or 4-throw pupilloplasty. The idea is to create a pinhole pupil of approximately 1.25 to 1.5 mm. The advantage in single-pass 4-throw pupilloplasty is one can do as many times till an ideal size pinhole is created. Postoperatively, the vision improved to 6:12, though the pentacam did not show much difference. With pinhole effect, patient sees the object clearly and well illuminated due to greater photoreceptor sensitivity as seen with Stiles-Crawford effect. One can dilate the pupil a little bit after single-pass 4-throw pupilloplasty, helping in fundus examination, as published in the October issue of JCRS 2017. Field defects are not significantly noticed after pinhole pupilloplasty. Approximately 15 to 31% of patients undergoing full-thickness corneal transplantation may develop post-operative astigmatism greater than 5 diopters. Astigmatism after corneal transplantation can cause visual loss despite a clear corneal graft. Pinhole pupilloplasty (PPP) helps achieve the pinhole effect. A patient with high astigmatism after penetrating keratoplasty improved to 6/12 after pinhole pupilloplasty. Myotics have been recommended, although it is associated with drawbacks like frontal headache, nausea, and bronchospasm. Prolonged use of myotics can lead to ciliary muscle spasm that may induce retinal detachment in myopic eyes. A one-eyed patient having an ACIOL which had partly eroded through the subconjunctival space with high astigmatism was explanted and a glued IOL performed with pinhole pupilloplasty. Centration of the pupil can be achieved preoperatively by marking the center of the cornea or intraoperatively by gauging the position of the light reflex of the microscope. Pinhole allows light rays to reach the retina without the interference of optical problems of the eye. Intraoperatively, a measuring caliper or intraoperative OCT can be used to quantify the pupil size during surgery. We designed a pinhole marker with a diameter of 1.5 mm. This can be passed into the anterior chamber to help create a 1.5 mm pinhole pupil. Pinhole pupilloplasty or PPP helps to filter the stray light from the periphery of cornea in cases with higher order corneal irregular astigmatism. The pinhole marker can be used at the corneal level, as seen in this case of keratoglobus, where pinhole pupilloplasty was performed. An ideal sized pinhole can also be made with the help of the vitrectomy probe if the pupil has become too small. The light of the microscope can be used to locate the center of the pupil for good centration of the pinhole. A limitation of the procedure could be insufficient iris tissue to perform the pupilloplasty. Another limitation would be to perform this procedure in a phakic eye. A phakic eye should be made pseudophakic as there are high chances of cataract forming during pupilloplasty. Although there are limitations of the procedure, advantage of being able to focus and achieving an improvement in visual functionality outweighs the shortcomings. For achieving the pinhole effect, surgical pupilloplasty is cost-effective and an efficient method, as no specially designed device is needed for the same.